there are a few things I want to cover on presentation. So there are the primary purpose of reviewing presentation today is to help you guide how to create the master presentation for the trainer program for the master slide deck. But the secondary purpose is, like I've said in my meeting last night, is that I want to work with you guys in trying to make you better educator and have better skills in educating, in teaching, and be known as a teacher and a leader in the field, an educational leader in the field. So the key of starting a presentation as an educator, but also even if you're just a presenter and education is not your primary goal for that day, but to have a good presentation, it has to be well thought out. And what I mean by that, that you start with very precise objectives for the day. Objective writing is a challenging task. The objective has to take a lot of time to think about it. You don't write it at the end of the presentation after collecting a lot of information. So you start with objective. You start with, okay, what am I trying to achieve today? The objective should be practical, useful, achievable, and measurable. You need to be able to say in some sense, even if you're not measuring it that day, somebody can look at your objective and say, oh yeah, it could be measured by asking these 4 questions or these 5 questions. So let's look at some of the objectives from my presentation. So I'm going to share my screen and look at some of those objectives. Let's look at this PowerPoint presentation on Parkinson's disease that I do for my residents. So let's look at this list of objectives. So the objective starts with a descriptive word of what the capacity or ability will be achieved. This is based on this pyramid, and I've been trying to think the name, but I'll think of it and send it to you later. But there is this pyramid which has the knowledge at the very bottom, and the very minimum thing that you should achieve that is a knowledge. So a knowledge should be that the participants at the end of this talk, the participants would be able to list 5 causes of Parkinsonism, or list 10 different medications of Parkinson's disease. So list is an example, describe is an example. Describe is a knowledge level, kind of a very bottom line kind of an achievement that you are doing. A bit above that will be an analytical step set, which goes beyond just listing or beyond being able to just reproduce the information, be able to analyze it a little bit. So something like discuss is a word that you could use, that the participants will be able to discuss this, this, and this. Discussion now means that they will be able to take the information in a way that they can analyze it, put it together, and then reproduce in a more thought out manner, a more creative manner. And then it goes higher and higher levels of achievement. Some workshops that I do, I use more descriptive information, like patients will be able to apply this information into what they're trying to do. Ali is also having trouble not getting the sound. Ali, make sure, my saying it out will not help. So Walid, see if you can help him. And I'm going to send a message to Ali. Please make sure your microphone and speaker is connected and permissions given to Zoom to access them. I'm assuming that everybody else can hear me speak. If that's not the case, please post a message. Or turn your speaker on and let me know. So the first thing is that what kind of level you want to achieve. So if I, it's called Bloom's taxonomy. Let me see if I have the Bloom's taxonomy to show you. So the idea of Bloom's taxonomy is that what you're trying to achieve should be more and more applicable, rather than something very basic. So if I share my other screen, so you can see now my browser, and I pulled up these examples of Bloom taxonomy. And these are the different levels that you're trying to achieve during the presentation. So the bottom line is just the information, which is the remember part here. And then understand is where you're going a little deeper, apply is a little above, analyze above, evaluate is above, and create is even more. So for example, if I say that at the end of this talk, the audience will be able to create an injection plan for cervical dystonia for Botox injection. Now, that is the highest level that I can achieve. Now, the problem is that if you are writing a course, you can use such high level of achievements on Bloom's taxonomy, the highest level of achievement. But when you're writing an objective for a presentation, or a one-day program or workshop, then you have to scale yourself back and see, okay, what is practicable? What can I achieve today? Is it just remembering list or something? Would I be able to go to understand? Or should I be able to go to apply? And it depends. It's a combination of what audience you have and what time you have and what topic you have. And all these three put together, you may be able to go to a certain point and reach a certain level on these Bloom taxonomy. Otherwise, you scale back down to the lowest possible. Remember, it has to be achievable and it has to be measurable that you achieved it. So that's the first descriptive word or level where you start with writing an objective. And after that, you go to the actual content of what you're doing. So let's look at one of these objectives here. Let me reshare the presentation. Maybe I'll just share my desktop so you have everything. All right, so now I think you're seeing my whole desktop. Hopefully it doesn't slow things down too much. But if you look at my presentation here, I think it's just better to focus and not share everything and confuse you guys. So the first objective is describe. At the end of this talk, the participants will be able to describe essential features of patients with Parkinson's disease and how they are different from similar diseases. So the objective is diagnosis and differential diagnosis. I'm saying that at the end of the patient, they will be able to describe essential features. Now, I didn't go crazy and say they were able to describe all the features of patients' Parkinson's disease. I said essential features. Now, it's up to me to define those essential features in the talk and then make sure that by the end of it, I have reached that objective by the end of this presentation. And it's an hour and a half, 1.5 hour long, actually 2 hour long presentation with the residents. So I have a lot more time to be able to reach it. Now, if you're doing a 20-minute talk, you may not even list this as a whole objective. You may modify the objective and you say that at the end of this talk, the participants will be able to describe few common features of patients presenting with symptoms of Parkinson's disease. So then you limit yourself and you're saying, okay, I'm gonna just able to explain them. What is a resting tremor? What's a rigidity? What's a gait impairment? And that's all I'm trying to do. And they will be able to just describe it and not apply it or use it at a higher level, like analyze or create or evaluate or something like that. So you cannot be ambitious and say that after a 20-minute talk, the participants will be able to evaluate patients presenting with Parkinson's disease. That's just not achievable in a 20-minute talk. So you have to define it logically on what is achievable, what you are able to do, and what you are trying to do. So, and then it should be measurable. So this one is a little vague and makes it a little hard to measure it, although you can be creative and measure it. But for example, all these three are written very broadly and a little bit more difficult to measure, although you can. So for example, what do I mean by measurable? Let's say that if you are saying that the participants will be able to describe essential features of patients with Parkinson's disease, then at the end of this talk, you give them a scenario of a patient who has a couple of these essential features and have them point out what in this history makes it likely to be Parkinson's disease. So now it is measurable. Now you have measured it, you prove it that all the participants were able to do it. It's a little different than a course, but in some sense it is a mini course. There is no pass and fail, but you should be able to say in some ways that I measured it and and I could show that I have achieved my objectives. Now, a really amazing presentation makes an effort to do that measurement. There are many creative ways you can do it. I have used few that I like, and I will explain those to you. But most talks don't have enough of a time to do the measuring component, especially if they are face-to-face and there's a limited time. But for example, one simple way of proving it is to show a video of a patient with Parkinson's disease and ask the audience, okay, please name the 3, 4, 5 essential features that you're seeing in this patient that are consistent with Parkinson's disease. And an audience may speak out loud and say resting tremor, rigidity, dragging of right leg, stoop posture, loss of expression, and things like that. And that way, you have now proven to yourself and to the audience that you have reached that measurable objective. Another way to do it is to just show pictures. So for example, if I go down on this talk, I think at the end of this talk, I have what I call a picture quiz. So picture quiz is just a simple way of saying, okay, have I reached my objective or not? So this was my objective of essential features of pathophysiology. So I show this picture and say, okay, what is this red thing in here? And they say Lewy bodies, and Lewy bodies made of alpha-synuclein. So it's kind of an open quiz to everyone. And I say, okay, see, I have achieved my objective. You know, there's some validation that the objective has been achieved. Now, another way that I occasionally use that I really like is what is called an exit ticket. An exit ticket uses a formula called 3-2-1. We basically ask everyone to write a ticket, which is like a short 1-page summary of something. And you ask them to write as a 3-2-1 formula, which is that write down 3 things that you learned from the course today, write down 2 things that you were going to go back and read more about, and write down 1 thing that was a sticking point and may or may not have been clarified by the end of this talk. Now, when they write it down and they hand it over to you, you give them 2 minutes or 5 minutes to write at the end of the talk, and then they write down and they submit. Now you can look at that exit ticket and say, I have or have not achieved my objectives. So you can see the 3 things they have learned. Are they matching with the 3 things that you were trying to teach? The 2 things they want to read more about, does that cover the 3 things you were trying to achieve in the objective? And the 1 thing that was a sticking point, was that part of the objective, or was something beyond the objective that was their sticking point? So you can use that approach, the exit ticket, the 3-2-1 approach. You can use a video quiz at the end. You can use a picture quiz. And really something like a picture quiz and a video quiz can be done in under a minute. So if you're planning even a 20-minute talk, you can plan it where you have 1 minute to open, including objective, and 18 minutes to present and 1 minute to close. It has many advantages. It has many advantages, not only proving your point, saying that, oh, see, I achieved my objective, I am so good. It has a learning objective, or learning advantage, that whatever you ask at the end has a much more likelihood of sticking to their brain, much more likelihood of remaining with them for much longer, 3 months, 6 months, or a year. So it is another learning tool that you're using. So it is actually part of the lecture. It helps with repetition. It helps with focusing what is important points. It's like take-home messages, but rather than just passively reading take-home messages to those participants or audience, you're asking them to summarize the take-home messages for you. You can even do that. You can say, okay, at the end of the talk, let's do a take-home message summary. Rather than me giving you take-home messages, I want each one of you, or 3 of you or 4 of you, to stand up and give me a take-home message. So randomly, anyone can raise their hand and say, okay, give me a take-home message. And you get 3 or 4 or 5 take-home messages from your audience. And that way you have shown that you've reached your objective. That way they actively think about it. They're actively engaged in the talk and are much more interested. They have a better experience and feeling about attending the talk. And then they remember it better. They remember it longer. They really understand it better. And you know that they have understood it. So I think this final assessment actually has a very useful and a beautiful role in improving the learning of the audience, of the participants, and of having a longer impression, more engagement of the audience, which we'll talk about a little bit more. So objectives are important. Objectives are useful. Objectives should be relevant, should be achievable within the time period that you have, and the objective should be measurable in a way which makes sense. even if you're not able to measure it, but ideally find creative ways to quickly measure them and increase audience engagement and increase audience satisfaction about the course or about the talk that you were giving. So that was objective. That was an important thing to cover in terms of presentation. So as you are assigned to make a presentation, take some time to sit down and think about the objective that you want to achieve on that talk. What are the 3 things that you want your audience to remember? How many objectives should be there? The general consensus is that the 3 is the maximum limit. There should not be more than 3 objectives for a talk. Actually, many audience speakers say that there should be only 1 objective, 1 achievable, measurable objective for each talk. However, you can make 2, you can make 3, you can even make 1 if it's a reasonable, well thought out objective for that day and was useful for your audience. So if you have a primary care physician as an audience and they're really general physician and you're giving talk about on advanced management of Parkinson's disease or advanced Parkinson's disease like motor fluctuation, dyskinesia and things like that, your only objective might be for them to be able to recognize in future in their patients these complex presentations that are seen in advanced Parkinson's disease, to be able to counsel the patient and refer the patient for advanced therapy to a neurologist. So that 1 objective might be the only useful and reasonable objective for the whole talk. And you don't have to come up with a second one or a third one. 1 is okay. A good thought out 1 achievable, measurable objective is really effective. So just because you have 5 things or 10 things you're trying to achieve doesn't make the talk more interesting. It doesn't make the talk more relevant, doesn't make the talk more exciting. So all right, so I'm going to move to the next point that I wanted to touch in terms of presentation. Besides the Bloom's taxonomy, which is the learning pyramid, the objective writing, which is important to begin with. And then the question is, let me make sure Ali is able to log in. I think Ali is not here. It says host is busy with another meeting. Ali is trying to log in. Let me see if I can send him a message. Make sure you are logging into the right meeting and not the old one. And let me give him the meeting ID. Again, all right. So yeah, technology, it takes time to learn all of this. Coming back to the presentation, so we created this idea of objective. We created the idea of the learning pyramid of what we're trying to achieve. We talked a little bit about immediate formative assessments at the end. The assessments are of 2 types. The summative assessments, which is the pass-fail kind of an assessment, where you're summing everything that you've taught someone, and the only goal of that assessment is to assess if someone has reached a level where you have decided that they are successful and they will graduate or they will pass. And that's the summative assessment. But the formative assessment is an assessment technique designed only to enhance their learning. That's the only purpose of that assessment. There is, the point is not to pass or fail them. The point is to further strengthen their learning, show them their weak areas, show them their strong points, and fill in those gaps of the weak areas. And assessments can do all of that. Assessments are actually very useful teaching tool, very useful learning tool for people. And that's why, there is a interest in everyone in doing multiple choice questions and things like that. The next important topic in creating a formative, in creating a presentation after objectives and learning pyramid, and is what content should be in the presentation, or more importantly, how much content should be in the presentation. Now, that varies from person to person. In general, I believe that the idea should be that the focus is on you. Who are you? You are the presenter. The presentation is not the presenter. The focus, we're losing audience when we have so much stuff on the slide that it's not complementing us and it's becoming the prime focus for the audience. Everybody just looking at the slide and reading the slide. Now, think about it. The idea of a seminar came from old days when someone would give a sermon. They will stand on the podium. There was no PowerPoint, there was no pictures, no slides, nothing. And they were talking to a large group of audience. They were enigmatic, they were energetic, they had a message, they were summarizing and organizing the message. We have lost in technology that point, that a seminar, a presentation is about you giving a message to your audience. And you capture a tool, you capture or show something only to complement and enhance what you're trying to teach. So for example, I was trying to teach you this concept of pyramid of learning, of Bloom's taxonomy. And then I went ahead, Googled the picture, pulled up the picture and shared it with you. So you can see exactly what I'm trying to say, because reproducing that image with words was becoming difficult and was taking longer. That is the only purpose of tools. The tools could be a drawing board, a chalkboard. The tools could be something like slides projected on a projector, or pictures that are being projected through these rotating projectors, or PowerPoint presentation on computer. Technology had made it easy to put things together onto a screen and just display it. But we forget that the point should not be that screen now replaces us, that everything that you need to see or everything you need to hear is just that screen. Ideally speaking, 80% of the time, the people should still be focusing on you. You are the presenter, you are the talk, you are the key event, you are the keynote speaker. And the screen is only there to complement something that you need to project, because you're saying something that is hard to follow unless someone looks at an example, either a picture or a video or a graphic. So that's how a presentation should be designed, to complement your message to the people. You are the messenger, you have the message, and everything else is just complementing it. Now, there are many ways to do it. There's many levels to it. There are many issues to it, but that's the bottom line concept. Now, I have seen really good presenters, and I try to do it, although it's somewhat hard with technology, that they actually turn off the screen once they've shown what they needed to show, so that people can focus on them, connect, and remember the message. That will take some time to reach that point. I think I'm there. I can turn the screen black when I don't need it. Although with the technology going back and forth to the computer, sometimes not practical. Although now with some of these handheld laser pointers you have, there are actually black screen buttons. So you can press this button, the screen goes black in PowerPoint, and you can keep talking. So people are focusing on you and not just looking at the pictures. So, a busy picture on the slide really doesn't make any sense. So let's look at some of these slides, and then for the resident lecture, and I can explain some of the ideas on why I was putting that slide on and what was the point and what I thought about when making that slide. So let me show you the resident lecture. Let's go back to that one, and let's go down. So the idea here is they're coming in to connect with a patient case, and these residents may or may not have seen a patient. So I'm trying to bring focus to the context, why it's important to talk about Parkinson's. Now, I have put too much information on this slide because I'm still trying to get rid of it. But the idea is that if I'm giving handout to my students, this is the minimum information they need to know from the slide. If I had nothing on there about the Richard, it may be that I gave such a beautiful lecture that they remembered the whole case, but maybe I'm not there. And if they're looking at the PowerPoint presentation as a PDF or as a handout afterwards, they at least have some information there. Now, that becomes a sticky point if you have slides that are not busy at all. So for example, let me go to another slide. So let's say this slide. Now, this slide has minimal information there. So I will put this slide up and I will start talking about, okay, what is a resting tremor? How do you recognize resting tremor? What is akinesia, bradykinesia? What is a gait exam? Now, the challenge with such a slide is that you are speaking a lot, but it's not there. It hurts in two ways. It hurts if you're giving handout to the students and they are supposed to review it later on and take an exam. Then it hurts because if they were not making extensive notes, then they will not have enough information. So one of the complaint could be from the students that, oh, we needed the information, we couldn't make notes, and there was not enough information on the slides, and slides were too bare. But that is usually a problem for the students who are taking an exam. Someone who is a primary care physician, who is a general physician or psychiatrist or a neurosurgeon, came in to listen to your talk, he will never look at the handouts again. He will go back to his world, he will remember whatever in his mind, and that's about it. And for him, it is a powerful slide. He can link the pictures in his mind on what is postural instability, what is akinesia, bradykinesia. If you show them the relevant picture as a hook point, as a focal point. So one way to do it for medical students separately is to have notes that you can give it as a handouts. There are two ways to do the notes. One way is to do the notes in the slides that can be printed out if you print. So for example, if I show you, if you go to, let me see if I can print it. If you go to print command on this, it asks you, are you gonna print just the slides in the layout, or you wanna do handouts as 2 slides, 4 slides, or 9 slides? It also gives you that, do you wanna print notes or not? If you do notes, then it print 1 slide at a time and have any notes on there listed on the slide that you added in the notes section. So you can actually give slides with the notes to the students. This is also useful if you're sharing slides. So we're creating this master deck that we'll be sharing with each other, and the notes section will be highly useful, because if I made these slides and someone else is presenting, if I just have a big 4 letter on the screen like this one, then they may not know, okay, what I was thinking, what was I trying to do, and give the message. And that's where the notes are useful for that presenter. Even if they're not giving it out to the students, they can actually use the notes at least to know what I was thinking, what I was trying to say. So let's go back to that slide and see what were my notes on that one. So the idea for this slide was not too much information, but the importance of the presentation. Why is this presentation important? So one of the key lessons for learners is that learners are only interested in learning something that is useful to them. So a lot of time we give a talk to students and we say, oh, the students were not interested. The students were not interested because they thought it was waste of time. They were not convinced by the speaker that the lecture is useful, lecture is important and relevant and applicable for their future. So you have to get them excited, you have to get them interested. So the point is here is that everybody sees Parkinson's patient. It could be a psychiatrist, could be a cardiologist, could be a urologist, it could be an orthopedic surgeon. Everyone will see Parkinson's patient because it's so common. There's a 4% lifetime risk. There is 1 in 25 of us will get Parkinson. So if I have a student, 100 class of a student of 100 in my class, I'll say that 4 out of you will develop Parkinson's disease. That immediately brings them the relevance and importance of the topic. So that what I was trying to do with this, why I added 4% that way, and what I was trying to do, and I've written that in my notes. Now, this is not a note that I need to go to give to the student, but it's a note that another speaker might want to see. Another way of doing it is through Syllabi. But before I go to Syllabi, let me share one more presentation to further highlight the importance of notes in a presentation, especially if you're gonna reuse it or share with someone. So let me share a different slide with you guys, a complex one. So this is another one. It is called Physiology of Movement. This is a very complex topic that I occasionally review for my fellow. I did it because of personal interest and because of a request by our fellows. But this is very complex, and it talks about how a movement is started. Now, I am reviewing topic that even I am not very familiar with and may not remember it. But at the same time, I don't want to load these slides with a lot of data. So some slides I've done it. So, it's a very complex, busy slide. It's not a slide that I like. Now I'm reading the slide and the audience is reading the slide, and my reading speed is different from their reading speed, and they're lost. I like a slide like this, that there is a study that I want to explain to them, and I just want to show the picture and walk them through the picture on what the study was done and what did they find. But now, even I'm worried that if I am not, if I haven't reviewed the data for 6 months or a year, am I giving the talk again, I might not be able to remember what I was going to say. So I made these extensive notes below the slide for myself to say what the experiment was, when was it done, who was doing it, what were the steps of the experiment, and what were the findings of the experiment. So I use it to capture complex information like that. So you will see that many of these slides, which only have pictures, have details below it as to what I'm supposed to be talking about. You know, who was Brodmann, what dissections he did, how was he figuring out these areas, why were they numbered in a certain way, what was 1, what was 2, what was 3, why were they different, and you know, what new architectural maps have been reported by other people, and so on and so forth. But these are complex topics, and you know, it's not something I do every day. It's not going to be on tip of my finger, so I will keep it as notes on the slides as extensively as I need to, as much as I want to, and so on and so forth. So that's the idea of notes. The other thing that you could do is the syllabi or syllabus. This is something that I started doing when I was presenting at AAN, American Academy of Neurology. They require you to, in addition to uploading the presentation that they will share with all the audience, you also have to give a 3-page, 2-page, and now 1-page summary of the whole topic that you're reviewing. Basically a summary of the content that you will be discussing. But it's not just the slides copy pasted onto a content. You actually have to write it as a short essay. Similar to the reading assignment that you were doing, like the required reading assignments, you were writing an essay on the topic, starting with that reading assignment, but adding further information into it to make a useful essay or a summary for everyone. So if I show you an example of what I've done before, let me share a syllabus on one of my AN topics. So this is a syllabus that I wrote for my talk on botulinum toxin injections for cervical dystonia. So this starts with the chemotherapy cervical dystonia. I give a summary of introduction, the definitions, the generalities, treatment options, the evidence for the trials, the injection technique summary, adverse effects, summary and tips, and then references on most of the information I'm listing. The references are, how you call it, are optional. You know, not every syllabi or summary has the reference, but I think they're useful, and I think AN encourages it. So that's why I put references there. But the idea is that they are kind of in the organization. The syllabus is written in similar to an organization of my presentation talk, that in my mind, I'm going through the definition of cervical dystonia, then the generalities of cervical dystonia next, and the treatment options. But it does not look anything like the presentation. It is more of a cogent summary of the information that I'm trying to cover through the slides, and the slides may be designed differently. And I think you've seen my talk on cervical dystonia and how that looks. It's mostly pictures and a little bit of information, but you can see this is more of the information that I will be speaking as I'm going through the slides. Not all of the information I'll be speaking, to be honest, because you can't put everything there, and you know, you have to be you have to adapt on the day on how you're presenting, but it will carry most of the useful information there. So another thing that we can do, and maybe we should do, is that as you guys are assigned to make presentation, also make a syllabus, so that everybody, you know, when you are presenting someone else's talk, you can read the syllabus and see what the other guy was trying to teach in a content format in the presentation. So this may be in addition to the notes on the slides, or this, you know, as a complement to the presentation. And hopefully once we have it for every presentation, it'll be very useful for everyone to have that. So this was the second important topic on the presentation. What content should be there? What should be shown to the audience? What should not be shown? Let me quickly go through a few other slides in terms of contents of my other presentation on what I'm trying to do. Here it is. So you can see that here I use just one picture to show the different aspects. I pointed them out. I don't have to point it out this way on the picture. I can just point it out using a laser pointer. You can see that I use a graph that I copied from somewhere that was walking through the differential. You can see that this is another picture I borrowed. This is a very simple slide that is trying to highlight that the men have Parkinson's disease 2 times as common as women. Now, I could put a text there, but I think this is much more memorable. So they can remember and see that men were on one side, they were red, they were twice as common as the women. It was based on the Italian longitudinal study. And then I have my notes there to remind me how many individuals were there, what age range, and things like that, and where it was in 8 Italian municipalities. So that, you know, that's one way of making a slide. That's another slide that is talking about the age-based onset. There's a slide copied from somewhere, but I don't have to put any text there. I can just walk the people from the slide. I can show them how the incidence is increasing after age 60, 70, 80, 90 in all different countries. It kind of follows the same trend. And I have written some notes down here for myself for extra information that I wanted to remember. Again, this is a simple slide. I'm talking about loss of pigment neurons. I orient them to the slide. I say, okay, these are two different brains. This is a section from the brain stem, and this is midbrain area. There's the quadrigeminal plates in front, the crux cerebri. There's a colliculus behind. There's the red nucleus visible. The black lines of substantia nigra. And Parkinson's brain, the black lines are gone. So simple slides like that, you can explain a lot of things. You don't even have to write in the notes because you kind of know the content. You are the subject matter experts. You know the subject. So you really don't have to have things on the slide to remember what you need to say. You can talk about Lewy bodies. You can talk about how the alpha-synuclein normal is organized, and it's the clumping of distorted alpha-synuclein that forms the basis of the Lewy bodies, and how they stain with alpha-synuclein, and that's how we know that Lewy bodies have alpha-synuclein in them. So you kind of see how I prepared these slides, which are visual, easy to remember. There's a hook picture that's there, improves their retention, but I have content to talk about, and I have content that in the notes, and then I can extend it and make syllabi and things like that. You can make a very busy, complex topic simple by putting a picture in. So this is a picture of a neuron overlap with the cartoon of showing multiple pathways that can go wrong. I can even walk through the pathways if it's a advanced audience, like a neurology audience, like you guys. If I'm speaking to you, I will actually walk you through these different pathways of alpha-synuclein, LRRK2, polymerization, and give you examples of where the breakdown might happen. But if it's a simple audience, like primary care physicians, I can use the same picture and just focus on giving the message that Parkinson's disease is a complex process. It's an interaction of many different things going on in the environment, and it may be that Parkinson's disease can be caused through different pathways. So some patients may have it because of this, some may have it because of that, and so on and so forth. I just focus on that message, and they get it. They get the idea that it's an interaction of various things happening. So that's discussion on the content. There is a couple of other things I want to quickly touch on. I talked about the text versus picture, the notes, the syllabi, use of black screen in between. You are the presenter. Remember, you are the focus. Bring them to you, talk to them. I talked about objective writing and measuring the objective at the end of the talk, a learning pyramid to use, built-in assessments during the presentation, which are simple, formative. They're not pass-fail assessment. That's not the goal. The goal of those assessments is just to make sure that the audience was listening and kind of get it. In general, few people will speak, many would not speak, but that's okay. Even the ones who are not speaking, most of them are thinking in their mind, and they kind of got the message. The last thing that I want to touch on in terms of presentation, as we are nearing our hour, is the 4 sources of tension. There are 4 sources of tension in the room as you stand on the podium and start talking about it. The first source of tension is you. Who are you, and why should they listen to you? So the first thing you should do is to address yourself. You say, I'm Danish Bahati. I am a movement disorder neurologist. I am the co-director for Parkinson's Disease Clinic, and I see a lot of Parkinson's patients, and that's why I am here. So they get some context. You can say, I've done a mini fellowship in movement disorders. I've learned these courses, and I'm now trying to give back. So that's the first source of tension. The second source of tension is the audience themselves. They want to know why it's important for them, why they are there, what will it be meaningful, how it will be meaningful for them, how will they use it. So one thing you can do is to learn your audience. You can poll your audience quickly. You can say, okay, how many of you have seen patients with Parkinson's disease? Raise your hand. And now you have an idea if half of the class has you had never seen a patient with Parkinson's disease. And then you can say, okay, how many of you have heard about Parkinson's disease or read about it before? And you may realize that half of the classroom have not even heard about Parkinson's disease before. And so on and so forth. You can look at many different aspects. You can say, okay, how many of you are medical students? How many of you are primary care physicians? How many of you have been in practice for longer than 5 years? When we do conferences here, sometimes we ask, okay, how many of you are from Omaha? How many of you are from outside of Omaha? How many of you are therapists, physical therapists, speech therapists, nurses, and things like that? So you can kind of learn the audience, So you can then promise them that I am going to teach you because this is important for you because. So if they're primary care physicians and they have practice in the rural settings, then you can say, okay, I'm going to try to tell you something that will be useful for you so you can recognize Parkinson's disease in the patient that shows up so you don't miss it, because you don't have resource available and you need to be able to pick that up or something like that. So figure out your audience and take away that source of tension. Make it relevant to them, make it important to them, and tell them that you know who they are, you're paying attention to them, you're serious and about them and concerned about them. The third source of tension in the room is the environment. Is the screen visible? Is your voice audible to them? Can they even hear you? Can they see your face? Can they see the screen? Are they comfortable? Is it too cold, too warm, or something like that? So recognize any issue with the environment and open it to them. You say, oh, it's really cold in here. I'm freezing. Let's see if we can warm up by standing up and stomping our feet. So let's do a 2-minute exercise. Let's have everyone stand up and stretch, because you've been sitting for 2 hours during the symposium. It's been too long and you've not had a break. Or you can say, okay, I'm the last speaker before lunch hour and the lunch is coming next, and let's quickly get done with this so you can all go to lunch. So you're addressing the environment, the situation, as the third source of tension. And the fourth source of tension is the content. It's the challenge that, okay, I'm going to be bombarded with this complex subject. There will be a lot of different drugs, different names, terminology that will be used. That will be very complex. There are many ways to address it. One way is to make a presentation which is very nice and easy to follow. Otherwise, you can calm them down. You can say, okay, we're going to talk about Parkinson's disease, and I know you're not familiar with it and you've not seen the patient's Parkinson's, and it's a complex subject, but I will make it easy for you. I will make it where you're able to follow it. I'll focus on what's relevant to you, what's important to you. If you see me talking about something that doesn't make sense, just raise your hand and I will redirect myself. If I'm speaking too fast, then raise your hand and I will try to slow down and make it relevant. If I speak a word that doesn't make any sense to you, raise your hand and ask me, what's the meaning of this word? What do I mean by that word? What do I mean by alpha-synuclein? And so on and so forth. So you can calm them down and release that source of tension. Once you have addressed those 4 sources of tension within first 1 minute to 2 minutes of opening, the audience really engages. They're there, they're ready to listen to you. And now if you have a good objective and good content, then you really get them. And then by the end of the talk, you can check on them that they got it, was objective achieved, and that makes a whole package really nice. It can be done in 20 minutes, the same thing, the same flow. It can be done in 2 hours, the same thing and same flow, or the whole day. If you think about these 3 different aspects of the presentation, the objectives, the slides themselves, how they would look, and sources of tension. How am I gonna make this day work and people work? So now I think you have the tools necessary to start putting together the presentations. The next step will be that I will start a Slack group, unless I hear differently from you guys, so that we continue this discussion. And the next step will be that we will poll to see if you want me to assign you guys the presentation topics, probably in pairs, 2 of you assigned to same topic, or you want to pick your topic and your partner, either based on the partner, the topic is secondary, or based on topic, the partner is secondary. You like a specific topic and who doesn't care who else is partner with you. So we'll do a poll on that and see how you want to go. And I'll stop here and I will take questions from you guys about anything we talked about last night or this morning. And this recording will be available to be viewed just like the other one. You can raise your hand on this system. You can type a question on the chat box and I will see it. You can also unmute yourself and speak. If you're muted, then I won't be able to hear you. If you unmute, then you can speak. But if you raise your hand, then we will unmute you so we can unmute one person at a time and not too many are speaking at the same time. I'll pause and I'll wait around for a few minutes to hear from you over the next 4 minutes as we finish. one more thing, the recording from the last night was deleted from online because of the space issue. I will upload it into a YouTube channel and then repost the link for the YouTube location of the last night meeting conference that discussed the structure and the purpose of this program. So if you need to go back and listen to it again, you have it available. And again, this one we will download and also make it available permanently on YouTube for the next year or two for you guys to listen to. All right, let me just poll you guys while you're here, the few of you that are here. Let me ask you guys, do you prefer to be assigned to a topic, or you prefer to choose either the partner or the topic? I'm typing it in the chat box. If you're able to see that, kindly reply in the chat box. You're welcome to unmute yourself and answer too if you want to. Otherwise, you can just type in the chat box and answer there. Yes, all slides have to be finished before December 15th so that we have 1 week to have them reviewed by Professor Arsalan and Professor Nader and Atar. Hopefully there will not be too much of a challenge, because remember, it's not the content. We don't need to fill up the slides with information. Once you design the objectives, all you need to figure out is that what goes along with that objective, what is necessary. You have my slide decks available to be used as a starting point, and I think there's enough slides there that you may not, 70% of slides are already there, I believe, for these topics. If something is missing, if you need specific slide, you can always send me an email, a message. I will see if there is another presentation I have that may have the relevant slides that you need. I will also, as I said earlier yesterday, I will find all the assignments for Parkinson's that you guys did as part of the Movement Disorder Mini Fellowship and upload them too. So you have also that available as a resource and save you a lot of headache and time finding that information. But I think it's doable. If you start working on it, that'll be great. Work on it in that Drive folder so I can keep looking at it and keep giving you feedback. I think it's doable. We don't need a lot of slides, but let's get it done by December 15th, and so that by December 21st we can use these for presentation and finalize it that day. All right, we have 4 votes to be assigned a topic, so I think I will the onus is on me now, and I will take that challenge to assign topics to everyone to the best of my capacity, and assign people who can work together if 2 of you are assigned to a topic. Of course, and I'm happy to change things around if there's any concerns or issues. I'll try to get this done today, hopefully before going to bed. It's 11 p.m. here, so I still have another couple of hours to work, and I will try to get you the assignments on the Drive. Everybody is able to, let me type this down too. Everybody is able to access the Google Drive and see documents and presentations folder. So reply in the chat box if you're able to see the Google Drive. If you need the link again, let me know. Perfect. So, that's great. Let me give you the link again for the Google Drive. All right, here's the link. One person needed it. It's a good thing I asked. So let's All right, I think we can stop the recording here. I will stay on, and you guys can leave one by one, or if you think you're done. But I'll stay on until all of you are gone. In case someone had a question they wanted to ask me, I will stay until everybody is signed off. Well, feel free to sign off if you don't have any questions. I think we're done for this session too. And again, I will share the recording in WhatsApp, and I will share the Slack channel link to everyone. Is everyone a part of the Slack workspace for mini fellowship? Is anyone here who has not used Slack? Good. Sounds like you have all used Slack at least, and probably all of you are also on the Slack channel or workspace for mini fellowship. So I'll create a channel there, which will be a private channel for our PD Master Trainer program, and add you guys to it. But I will, for now, keep also sending messages in WhatsApp until I know for sure that everyone is in the Slack, and then we can drop the WhatsApp. Good. Feel free to sign off. I will stick around to be the last one to sign off.